biggest thing is figuring out, once you have a biopsy, that's the diagnosis, but then you have to figure out the stage. Stage is where things are. And it's very important in cervical cancer to know where it is. Obviously, if you have cervical cancer at stage 1, it's mostly on the cervix. And about 4 centimeters is usually our cutoff for what we think we can do with surgery. Think about like a bruise on an apple. You'd have a bruise, you're going to carve out some good tissue, get the bruise out. If you can do that with surgery, then it's reasonable to talk about surgery. A radical hysterectomy is a much more involved surgery than a regular hysterectomy. You actually take out some good tissue around, near the bowel and bladder, you take out lymph nodes. So it's a much more involved surgery. Fortunately, in the last decade, we've gotten to a point where we can do these through small incisions, either laparoscopically or through robotic surgery. And people can still go home the next day, but it's a pretty involved surgery. After that, if we don't see any cancer on the specimen outside of what we took out of the bruise and the lymph nodes are all normal, we may just do follow-up evaluations. And that's, obviously early stage. If you have advanced stage cervical cancer, or if the surgery you have had lymph nodes that are positive or other things, you may be talking about chemotherapy along with radiation. And that you can still be cured with this, even with stage 2, which is usually some vaginal involvement. Stage 3 has usually some pelvic sidewall involvement. You can still be cured with that, but it's just a much more involved process. Stage 4 cervical cancer is basically when you have cancer that's spread other places in your lungs, and that's just a much harder situation, much harder to treat.